But this is the uterus. Look at that. That's your uterus. There you go. And when you're pregnant, that thing is huge. I mean, crazy huge.
I can imagine.
So this is your fundus right here. And all of this is the body. Fundus, body. Now remember we talked about the uterine tube or the fallopian tube? That's what you're seeing right here on both sides. There they are. Very small. These little finger-like projections at the end is the fimbriae. You see it better over here. It's kind of smashed. But that's your fimbriae right there. And then where the fallopian tube and the uterus come together, right here is the isthmus. And on this side, the isthmus. And you can see the isthmus been tagged because you see a little pinhole right there. That's your isthmus. Okay? All right. Now, this is the ovary right here. That's your ovary. And then, of course, you can see the ovarian ligament very nicely right there. Ovarian ligament. On this side as well, ovary and ovarian ligament. Now, all of this right here is your broad ligament, this connective tissue that helps to anchor the uterus. That's your broad ligament. Your broad ligament. Okay? Now, when we turn this over, now ladies, again, we can see our three holes. We can see this is your cervix. This is your vagina. So this is vagina. That's your urethra. And then this area back here would be the anus back here. And this right here, that's the bladder. See how the uterus sits on top of the bladder? That's the bladder. Okay. All right. So, and this is showing you your what? What's this structure?
Ureter.
Your ureter. You can see it's coming right down here to the bladder.
Can you show the vagina and stuff again?
This is the vagina. And this is the cervix. Okay.
And the bladder, you said the anus?
This is the bladder. This is your urethra. And this is the anus back here. So now, and then it's important to know there's three holes there because our reproductive system and our urinary system are separate. Now this is a disease structure here. Look at that, ladies. That's a uterus. But notice, it doesn't look like this. This has nodules on it. That's fibrous tissue inside the uterus. So you can understand that endometriosis is rough. They do a job on you. But this is fibrous tissue. This is probably a cyst. This is definitely a cyst right here. And see, look at that. It's sitting right on the ovary. There's the poor little ovary. And that looks as big as a golf ball.
So did the person die from fiber?
That I'm not sure of. Maybe. And see how all this got cyst on it too?
Yeah. So is that why when you do the surgery, they tell you chances of being pregnant is very...
Oh, yeah. If you have endometriosis?
No, the fiber.